Hello and welcome to our program, In the Know, keeping pace with news and updates on COVID-19 vaccines. The CME program is supported by an educational grant from Janssen Therapeutics. Before we start, please take a moment to answer the pre-polls in the tweets below and let us know who you are. This is a CME certified program. Details regarding how to obtain your credit are located in the tweets below. Be sure to watch our handles for additional CME COVID programming and follow Bottom CE for CME certified programs on Twitter. I'm Dr. Tara Smith. I'm an infectious disease epidemiologist at Kent State University in Ohio, and I'm joined today by my colleagues, Drs. Ogbuagu and Dr. Vermund.
My name is Sten Vermund. I'm a professor and dean at the Yale School of Public Health. I'm a pediatrician and infectious disease epidemiologist.
Hello, everyone. I'm Dr. Onyema Ogbuagu. I'm an associate professor of infectious disease in Yale School of Medicine. Our disclosures are shown on your screen. Our program today is the last in the series of newsrooms about COVID-19 vaccine updates. Head to @BonhamCE on Twitter to catch up on other discussions regarding COVID-19 vaccine developments. Over the course of our discussion today, we'll be addressing the following learning objectives: translate the data regarding clinical trial efficacy and real-world effectiveness of the COVID-19 vaccines in use in the United States, review the recommendations for the special patient populations, including case definitions, patient characteristics, and guidance documents. These are the topics we will be discussing today.
I'll be discussing the effectiveness of a third dose of the Pfizer, BioNTech, and Moderna vaccines in preventing COVID-19 hospitalization among immunocompromised and immunocompetent adults. So the purpose of this study was to look at this third dose in preventing hospitalization among adults with and without immunocompromising conditions. And they did this using case-controlled data, looking at 21 hospitals in 18 states in the IV network among adults that were aged 18 years or older. This was August through December 2021, where Delta was the predominant variant during that particular time. And so this is looking at the population that was included in here. So in this middle column are the immunocompromised individuals, and in the final column are those who are not immunocompromised. And comparing among those who were unvaccinated, those who had 2 doses of the mRNA vaccines, or those who had 3 doses. And you can see case patients were most common in those who were unvaccinated, and 58% of those who were immunocompromised, and 70% who were not immunocompromised. And 2 and 3 doses did offer more protection, especially 3 doses, which was significant in both immunocompromised and non-immunocompromised groups. This is looking at breakthrough infections. So all of these individuals were vaccinated, and they're looking at individuals who are hospitalized and positive for COVID-19. So you can see that immunocompromised patients dominated here, 51% versus 22% who were not immunocompromised, and this group had 2 doses of the vaccine. 3 doses were found to be more protective, with 16% of those who were immunocompromised versus 1% who were not immunocompromised. And then in the next panel, it's comparing vaccine effectiveness for those who are vaccinated versus those who are not vaccinated in the immunocompromised versus the not immunocompromised groups. And you can see here that, again, while 2 doses was pretty effective in both groups, 3 doses provided additional protection, both in the immunocompromised groups, where vaccine effectiveness went up to 88%, as well as in the non-immunocompromised group, where 3 doses provided vaccine effectiveness that was similar to that seen in the clinical trial, so back to 97%. So the takeaways from this were that receipt of this third dose of the mRNA vaccines increased vaccine effectiveness against hospitalization among adults both with and without immunocompromising conditions. So that immunocompromised, it increased vaccine effectiveness from 69% to 88%, and those who were not immunocompromised had a similar increase from 82% back up to 97% against hospitalization. So the recommendation is that the administration of this third dose as part of a primary series in immunocompromised individuals or a booster dose in immunocompetent patients improves protection against COVID-19 hospitalization.
I'm happy to discuss 2 publications, both in the Morbidity and Mortality Weekly Report from the CDC late last year and this year. They're both concerning real-world effectiveness. How well do COVID vaccines work in our society in teenagers, the ages 12 to 18? One looks at hospitalization, and the other looks at the multi-system inflammatory syndrome in children. We often call that MISC. This looked at hospitalizations over the summer of 2021 and MISC cases in the latter half of 2021. The characteristics of participants with COVID-19 who were hospitalized and those with MISC who were also hospitalized were compared with control groups. These were hospitalized children who did not have COVID-19. What we learned was that the fully vaccinated children were underrepresented by far in the COVID-19 hospitalizations compared to the hospitalized controls. And similarly, the MISC cases were far less likely to have been fully vaccinated than their counterparts who were hospitalized for other reasons. This calculates to 97% of the COVID-19 hospitalizations being among the unvaccinated, 95% of the MISC cases who were unvaccinated, and 100% of the critically ill patients who required life support were unvaccinated, representing about 17% of the hospitalized COVID-19 patients and 39% of those who had MISC. So there is little doubt that among teenagers, we see tremendous vaccine benefits. 2 doses of the Pfizer-BioNTech mRNA vaccine were highly effective in preventing COVID-19 hospitalization and MISC in teenagers. We expect data to be emerging in the 5 to 11-year group, and I'll be happy to put my money on similar results. And we see now that vaccines continue to show benefit for children in preventing serious disease.
Now let's move on to assessing the impact of COVID-19 on pregnancy and also pregnancy outcomes for women. And this is data from 8 integrated healthcare organizations in the United States with a time frame from December 2020 through July 2021. Now, this study examined the effect of COVID-19 vaccination on preterm birth, as well as small for gestational age at birth outcomes. This was a retrospective cohort of live births from 8 vaccine safety data link healthcare organizations. And the study population was single gestation pregnant women with estimated start or last menstrual period during the period spanning from May 17 through October 24, 2020. So here are the key population characteristics in this study. Overall, they were about 26,000 pregnancy outcomes. You can see the race ethnicity mix, and the median age of these pregnant women was 30 for the unvaccinated group and 32 for those who were vaccinated. Regarding what type of vaccines these women received, we see that majority received Pfizer-BioNTech, so about 54% of the vaccinated population, but 40% and about 4% received Moderna and J&J respectively. Most of these women received the vaccine in the 3rd trimester of pregnancy, so roughly about 62%. And then otherwise, the vast majority received it after the 1st trimester. Less than 2% received it very early on in pregnancy. And so the results are shown. And in this study, they compare the preterm birth and SGA birth outcomes among women stratified by those who were unvaccinated in blue, which are the reference group, compared to those who received any of those 3 vaccines, either the mRNA or viral vector vaccines shown in yellow. And so the overall prevalence of preterm births across both arms is about 6.6 per 100 live births. And for the small for gestational age births, what 8.2 per 100 live births. Now, when we look at the prevalence of these events per 100 live births stratified by receipt of vaccine or those who were unvaccinated, you see that the prevalence is lower for preterm births among those who received vaccination compared to the unvaccinated, while the small for gestational age were similar between both. When you look at the overall adjusted hazard ratio, none of these differences were clinically significant. However, it at least shows that those who were vaccinated did not have higher adverse pregnancy outcomes than those who were not vaccinated. So the key takeaways from this study in that over 40,000 pregnant women COVID-19 vaccination during pregnancy as compared to those who were unvaccinated was not associated with significantly increased adverse pregnancy outcomes, including preterm birth or small for gestational age at birth. And this was independent of the type of vaccine doses received during pregnancy. So these data are encouraging and support the CDC's recommendation for safe COVID-19 vaccination during pregnancy. Thank you so much for joining us today. Please make sure to claim your CME credits by completing the post-test and evaluation form at the link on screen. And make sure to follow Bonham CE on Twitter to stay tuned for more CME.